Hi, how are you doing today?
I'm good. How are you?
Good, thank you. My name is Amy. I'm going to be the nurse doing your physical assessment today. So the first thing I'd like to do is just ask your name and date of birth.
Cassandra Stevens, 11/26/84.
Thank you. And do you know where you are today?
I'm at Chamberlain Hospital.
Thank you. And who is the President of the United States?
Obama.
Thank you. Patient is alert and oriented ×3. Patient is appropriately dressed for the weather. She is well groomed. She is answering questions while maintaining eye contact and smiling. So I'm going to go ahead and have you walk over to that scale so we can take your height and weight. Patient's gait is smooth and well coordinated. I would take her height and weight. You can go ahead and have a seat back on the bed for me. We would then proceed with the rest of the vital signs, including the temperature, pulse, respirations, and blood pressure. All would be assessed and within normal limits. And are you in any pain today?
No, I'm not.
Thank you. So now for the skin assessment, we're going to look at her arms and her hands. We're going to notice that her skin color is even throughout, that it is appropriate for race. Her skin is smooth and warm to the touch. She does have a couple of different birthmarks. Are any of these new, changed recently?
No, they're old.
Thank you. We've got a scar on her hand and a tattoo on her other hand. We're going to look at her nails. Her nails are smooth. They are chipped. Do you bite your nails?
Yes, I do.
Yes. And her cuticles have just a little bit of cuts and lesions, and her capillary refill is less than 2 seconds. So now we're going to look at her head and face. Her head is normocephalic. Her face is symmetrical. Her palpebral fissures fall within the same plane and are symmetrical. Can you go ahead and smile for me? Thank you. Her smile is symmetrical and even. So now we're going to palpate her scalp. Let me know if you feel any tenderness or pain. Palpating for any lumps or bumps. Thank you. And then we're going to divide her hair in 3 locations, looking for any lesions, infestation, and there's just a little bit of dandruff. So the next thing we're going to do is palpate her frontal and maxillary sinuses. Let me know if you feel any pain or tenderness. So her frontal sinuses
No.
and her maxillary sinuses.
No.
And I'm going to assess your temporomandibular joint. Go ahead and open your mouth, close, and then open and side to side. Good. No crepitus felt, no pain noted.
No.
Cranial nerve number 5 is intact. So the next thing we're going to do is your cervical lymph nodes. If you could just turn a little bit to your left for me. Thank you, make it a little closer. Preauricular, postauricular, occipital, posterior cervical, tonsillar, submandibular, submental, deep cervical chain, superficial cervical, and supraclavicular. And now I'm going to palpate your carotid pulse each side. Carotid pulse is 2+ bilaterally. You can go ahead and sit forward for me. And now I'm going to assess your range of motion. If you could look to the window and then look to the wall. And go ahead and drop your right ear down to your right shoulder and your left ear down to your left shoulder. And I'm going to ask that you do it all again against resistance. If you could look to the window and then look to the wall. And go ahead and drop your right ear down to your right shoulder and then your left ear down to your left shoulder. Good. Patient has adequate range of motion with strength against resistance. Cranial nerve number 11 is intact. So now we're going to look at her eye structures. Her eyebrows are free of lesions and dandruff. Her eyelashes curl up and away. Her lower lashes curl down and away. Her cornea is smooth and intact. Her conjunctiva, go ahead and look up for me, is pink with evidence of veins. Everything is smooth and glossy. So now I'm going to have you follow my pen light. Her gaze is smooth and well coordinated with no evidence of strabismus or nystagmus. Cranial nerves 3, 4, and 6 are intact. So now what I'd like you to do is just go ahead and look straight at me. And then follow my pen light. Pupils are equal, round, and reactive to light with accommodation noted and consensual reaction. I'm going to go ahead and look inside your ears. No redness, exudate, or dryness. I'm going to go ahead and pull on the pinna and push on the tragus. Any pain?
No.
Great. So looking at her nose is midline to face. I'm gonna go ahead and feel for any crepitus, any pain. No crepitus noted. I'm gonna go ahead and have you breathe in and breathe in on the other side. Good, both nares are patent, and we're going to look up inside the nose. No redness, drainage, exudate noted. So I'm gonna go ahead and have you swing your legs around the other side for me. Never mind, I need you to face back my way. We're gonna look inside your mouth. So, first thing I'm gonna do is just look at your lips. Your lips are pink and moist, just a little bit of dryness, normal this time of year. Go ahead and open up for me. Her buccal mucosa is pink, smooth, shiny, and intact. She has all of her teeth. She does have a couple of cavities, and then she has a lower permanent retainer and an upper permanent retainer. And her gums are pink and well approximated to her teeth. Go ahead and stick your tongue out for me. Good, go ahead and lift your tongue up. Good, so the dorsal side is bumpy, the ventral side is smooth, glossy with evidence of veins. I'm gonna go ahead and have you say light, tight dynamite.
Light, tight dynamite.
Thank you, cranial nerve number 12 is intact. Go ahead and stick your tongue out one more time for me. And go ahead and say ah. Good, patient has her tonsils. They are a +1, and there is no exudate. She has her hard and soft palate are pink and glossy and intact, and there is no evidence of any saliva pooling in the back of her cheeks. Uvula rises with phonation. Cranial nerve number 9 and 10 is intact. So now if you could swing your legs around, we'll do a thoracic. So the first thing we're going to do is inspect her thoracic cage for symmetry, and we're going to look at her AP versus her transverse diameter, noting that her AP is half the distance of her transverse diameter. We are going to assess for symmetric thoracic expansion with inhalation. Go ahead and take a deep breath in for me. Good, and we have symmetric thoracic expansion with each deep breath. So we're going to do tactile fremitus on her back. Every time that I touch your back, I'd like for you to say the phrase blue moon.
Blue moon, 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 blue moon.
Lift up your right arm,
blue moon,
and then your left arm, please.
blue moon.
Thank you. And now we're going to percuss the lung fields. And then we're going to auscultate the lung fields. At this point, we would always auscultate skin to stethoscope, but for the purpose of the video, we are going to show over the shirt so that you can see the proper location and technique. Just take breaths normally. Go ahead and lay back in the bed for me. We're going to do the cardiac portion. So the first thing we would do is inspect the skin of the precordium, looking for even skin tone throughout and that it is pink. We are going to go ahead and palpate for any pulsations or thrills. We're going to notice that there is no evidence of any pulsations, heaves, or thrills upon inspection and palpation. The next thing we're going to do is we're going to auscultate for regular rate and rhythm, listening to S1 and S2. Again, we would listen skin to stethoscope, but for the video, we're going to listen over your shirt for purposes of making sure the technique is correct. Patient has a regular rate and rhythm with no evidence of any murmurs. The next thing we'll do is auscultate the heart sounds in the 5 locations, first using the diaphragm of the stethoscope, starting with the aortic, then the pulmonic, Erb's point, tricuspid, and mitral, and then we'll listen to the same 5 locations using the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. So now we'll do our peripheral vascular assessment, starting with bilateral pulses. We're going to feel our radial pulse, and then our brachial pulse, our posterior tibialis, and a dorsalis pedis. All pulses are present at a 2+. We are then going to look at her shins in order to assess the color of the skin, looking for any pretibial edema. We're going to press down. No pretibial edema. No evidence of any varicosities or skin abnormalities. And then we are going to assess her capillary refill and her toes. It is 2+. I can go ahead and help you sit upright. Thank you for your time. Do you have any questions?
No, I do not.
Thank you.